All right, so I want to show some myofascial cupping for underneath the clavicle, and this is used more as a manual therapy technique in this demonstration than it is as an acupressure thing. So make sure you put a lot of cream for glide, and then squeeze to create a little vacuum and draw of the tissue. I like keeping a washcloth handy because if you keep the skin taut, it's easier to receive. I'm just going to go back and forth. How's that? Good. Good. It's both doing cross fiber friction. It's also bringing fresh blood and lymph to the area. You can see already some change in the skin color. She's got a couple little adhesions here that may get some slight discoloration. And I'm going to pull the skin taut. And then right at the junction, is that too much? A little bit?
It's intense.
It's intense, okay. I'm going to reduce the pressure a little bit. Better?
Yeah.
Okay.
Trying to tolerate.
It's okay, yeah. Better?
Mm-hmm.
Mm-hmm. So what I just did is I released, you can either just release the pressure a little bit by sneaking your finger or getting it released completely and then just squeeze, doing less of a squeeze. So I'm using the smaller cup to get closer, more under the side of the clavicle. If I wanted to do something a little broader, I could use this slightly, and I will not squeeze as deep, just a little broader. So now I've dropped down a little bit lower, more towards the pecs. How's that?
Mm-hmm.
Yeah. And some circular motions. If the skin is looser, I like to draw it taut. It's easier to receive. It's kind of like if any of you have ever received waxing, a good waxer will pull it taut before removing the wax. It's a similar sort of thing with the cupping. There you go. To the other side, just so you can see. So it'll just be a little bit of a repeat. But you can already see, you know, real change in circulation to the area. I mean, it's pretty distinct from side to side.
Wow.
Yeah, you can see what a difference, huh? And also, temperature-wise, can you feel the heat? Yeah, coming out of that. So I'm going to start not do quite as much draw as I began. Better?
Mm-hmm.
Okay. I'm also going to anchor, help the skin be a little more taut. And you can get a little bit more detailed with some of the little adhesions underneath the clavicle, kind of going back and forth from side to side. Is that okay?
Yeah, that's way better.
Way better?
Section them out.
Yeah. Each person's going to have a different preference. I would say, because I have more experience, I sometimes will start a little stronger. If you're newer, I would say start softer and work your way up. There you go. Especially if it's somebody's first time, I'd rather you be more mild. There we go. And then in here, that's where the joints come together. One of the really nice things about the silicone, although I do the glass cupping. The silicone's really nice for when bones and joints come together because there's pliability. It'll let you get some of the adhesion patterns without it being too difficult for the body to receive, and also without losing vacuum, because it gives around some of the more bonier landmarks. And I can even make it thinner, right? And then use it thin like a tool, like similar to gua sha. I mean, even if I don't have the suction, I could use it as a cross fiber friction tool, right? And then I'll just integrate with a little bit through here in the upper pecs. Also, some of this drawing does gently create a little traction with some of the intercostals too, which is nice. I won't do it on this video, but like for example, holding along the sternum, you would do with a lot less pressure, a lot less straw, but that could also help to open up people, just to rock side to side along here. And here. And sometimes I get a sense that sometimes I want to go in patterns. Sometimes, like here, it feels like it wants more circles. Can you feel that, Shannon? Yeah.
Oh, yeah.
Yeah.
That's great.
Can hear. Good. And then if you were doing more thorough work, you could follow some of the pathways. You have to be careful around the underarm because it's more sensitive skin, but you could gently follow where the pecs come down, for example.
That's great.
Feels good, huh?
Yeah. It's such a unique feeling.
How would you describe it? You don't have to have words if you don't.
It's just so different than the hand touch.
Mm-hmm. Yeah. No, just for now, for the sake of the. And then you want to make sure that you bring it down and integrate things well. But I mean, there's a lot more circulation. Heat comes off of it. It's a great thing to do with area where it's got too much inflammation. It helps to reduce some of the excess heat. You feel it, huh?
Mm-hmm.
Yeah. Okay, great. So that's a little myofascial cupping with silicone cups for addressing underneath the clavicle and some of the upper parts of the pecs.